We're going to assume that we're doing some bandage changes, maybe already for an existing wound, and we'll show you how to wrap it so that the horse stays safe and you stay safe. Key components of your wrap are going to be a non-stick sterile dressing to go over the wound. You're going to want a padding layer, and you're going to want your securing layers, and finally you'll want tape closing the wrap at the top and the bottom. So let's assume that Scooter here has a wound on his cannon. Place the dressing over the wound. You want to roll your padding off of the bottom of the roll. You can come down over the fetlock onto the pastern. You're going to come up, keeping it as smooth as possible. Notice that my feet are under me and I'm facing the horse's rear end. That way I can see if he's trying to cow kick. You never want to sit or put both knees on the ground. You want to roll the gauze around the back. Any pulling should be done when you come over the cannon bone. You never want to pull across the tendons. You want to keep your gauze layers overlapping. Cut the brown gauze using blunt-ended bandage scissors for safety. You can then secure the rest of the wrap with nice colored vet wrap. You never want to pull with this, and you never want it to connect to the skin directly. This sort of bandage is going to be self-tightening. It has almost an accordion effect. So if you pull it taut, it's going to tighten up again. When you have several layers in place, you can even tear it loose and it will stick. You're going to want to keep dirt, shavings, straw out of the wound with a nice tape, like an Elasticon type tape. That can be limited to just the top and bottom, though sometimes if you have a young horse that likes to chew at his wraps, you may want to actually cover the entire wrap with Elasticon for stability. So now that we've demonstrated wrapping a lower leg, which is going to be basically the same technique whether you're looking at a front leg or a hind leg, we'll show you how to wrap a wound on the upper leg. When you're wrapping a wound on the upper leg, you're actually going to need to do what's known as a stack wrap, where you place a standing wrap on the lower leg, then wrap your wounded area. Go ahead and use a plain standing wrap if you have one in your barn. You want to make sure to use something to keep it nice and padded. So again, when you're wrapping a leg, you want to make sure any tension is being applied across the front of the leg, across the cannon, and not across the back. You want your wrap to be coming off the bottom of the roll. That allows you to roll it off smoothly, and make sure that your layers are overlapping. That helps to prevent any of the layers from sliding and causing a tourniquet-like effect. Again, we're going to be placing the non-stick over the wound. Go ahead and cover it. Again, I cannot overemphasize the importance of having padding for your bandage. I like to use brown gauze as a securing layer, but you do want to make sure that you're leaving a margin of padding. This time you don't need to worry about it as much on the lower because everything is already padded. Making sure that your layers are overlapping so that you don't get edges that are cutting into the horse. With vet wrap, you want to make sure again that you're leaving your margin of padding and that you're rolling it on and not pulling, because again, it becomes much more self-constricting. The thing to remember with any sort of this sort of flexible bandage is that you don't want to have it directly against the horse's skin. It will act as a tourniquet. And again, you're going to want to have a securing tape layer at the top to keep dirt and debris out of your wrap. And that is how you wrap a wound on a knee. When you're working on a hind leg, it's important to remember to keep your head up and to stay as close to the horse as possible. Place the non-stick again on the wound. You can use a stack wrap with a hock. Often a hock wrap will stay simply because of the angular nature of the hock. You want to allow plenty of padding, especially coming over the tendon here. When you're wrapping around a hock, you often are going to go sort of a figure 8 configuration. When you're rolling on your gauze, again, you're not going to pull over the back. You're just going to roll it on. You'll pull across the front, then you'll come around the point of the hock, below the point, back and front, up and over. You're making sure to leave a gap at the point of the hock. Horses don't like to feel that their hock has been immobilized, and they will have a bad tendency, if the wrap feels too tight, to try to kick it off. Again, with your vet wrap, leaving a margin of padding so that it's not directly contacting the skin. And again, you're going to want to seal your wrap with a layer of tape such as Elasticon. It'll often take a horse a couple of strides to adjust to having a hock wrap. Oh. Way to demonstrate, Scoot. If you have any other questions about wrapping your horse's legs, please talk to your veterinarian or check out thehorse.com. For thehorse.com, I'm Dr. Christy Korp Minamiji.